Thank you for coming in. How are you feeling this afternoon? I'm sorry to hear. Do you mind giving me a brief description of the chest pain you're experiencing? Okay. And is it on one side more than the other? It's hard to tell. Do you feel any pain in any other areas of your body? Your arms, your neck, your back, chest, belly? Okay. I hope you don't mind. I'm just going to observe how you're, catering to one side there. Are you feeling okay? Okay. And how long has this been going on? All right. Has anybody examined you in the last couple of months since this has happened? All right. All right. No, it's okay. Just try to remain calm. You're safe here. No judgments. It's okay. All right. Well, if it's okay with you, what I'd like to start with is just a general examination and palpate some of the areas that you're describing to see if we can pinpoint where those locations are. If they are limited to your chest, sometimes you can get chest pain from other areas. So if you have like swelling of the intestines or the stomach, I know that a lot of times it can be confused because you'll get like a gas buildup in certain areas, and it can definitely make you feel uncomfortable in other areas. Okay. I'm gonna just take a couple minutes, sanitize my hands, and palpate some of the areas of your chest. Do you think that would be okay for me? All right. And if there's any area that feels uncomfortable, you don't want me to touch, irritated, anything like that, you just go ahead and tell me and I'll stop, okay? Okay. It's okay. You can just relax. I won't hurt you. Just take a breath in and let it out and try to let go of those muscles, okay? Yeah, I can tell you're a little tense. It's all right. I'll try to be as gentle as I can, okay? All right. So, describe to me a little bit about what your daily routine is from you wake up. Do you have coffee? Do you have food? Do you exercise? And how long does that usually go for? All right. Just going to press on your clavicle area and around the center of your chest. Is it okay if I move your shirt to the side so I can see a little better? Okay, thank you. Go ahead and keep on describing your day. And do you find yourself under a lot of stress on those kind of days? Okay. Any anxiety? Do you think that there's any one event during that process where you feel it more than others? Okay. I'm just going to kind of branch out along the tops of your chests and your pecs. Is that okay? Okay. Again, if this is uncomfortable or unpleasant, let me know and we'll just move on. Alrighty. Can you lift up your arms a little bit for me? Thank you. What about right here? These areas tender? Yeah, I can feel your muscles are really tight. Just try to relax if you can. Palpate right around under your ribs. So this can sometimes, if you have the hiccups or if you burp, things like that, it's okay. I'm just going to gently palpate right here. Moving down your tummy just a little bit more. Okay. I'm going to put some gloves on just so that I can kind of move around the skin a little bit easier without hurting you. going to start over again here at the top. And sometimes this feels a little bit more pleasant on the skin too. And lift up your arms again. Okay. Any pain when I press here? But that's not the source. Okay, I'm going to go down the center of your chest. If you can lift up your arms a little bit, I'm going to lift your tummy right under your rib cage. And I'm going to press a little bit firmly, okay? Definitely let me know if this hurts, alright. Okay. It does? Okay. I'm just going to move down your belly a little. Right here. I know it's kind of a personal question, but what are your dietary habits? And how often do you go to the bathroom? Do you drink a lot of liquid during the day? A lot of water? Soda? Pop? How about alcohol? No judgment. Go ahead and be honest. If I'm going to give you treatment or recommendations, but this is a judgment-free zone, so I'm not going to judge. Any other substances? Okay. And does that help with pain, anxiety, or sleep? Okay. No, like I said, no judgments. What works for some doesn't always work for others, and vice versa. So the spot right here on your right. Okay. And do you have any difficulty going to the bathroom? Okay. Alrighty. I'm going to move up your neck. I'm going to palpate the skin just around your neck. I'm looking for swollen glands. I'm going to move down your neck to your armpits and where a lot of those primary lymph glands will be, alright? In some areas it's ticklish. I might apply a little bit more pressure to kind of eliminate that a little bit more, okay? Okay. Just relax. And for most people, this is actually a really pleasant experience, okay? I'm just going to start up by your ears and move up your jaw. And around your sinuses up here by your nose. Up your forehead a little. I know that this might seem like it's a far away area from where you're experiencing the pain, but sometimes your lymph system can tell us a lot more about you than you realize. Okay. Feel your scalp a little bit here. Just gently palpate around the top. And I'm sorry if I mess up your hair just a bit. And just behind the head, right where your base of your neck is here. You do have a little bit of swelling that's happening on your right side. Have you had a cold, a sore throat, anything like that? it's not symmetrical. You don't quite have the same tension built up. Are you experiencing more pain on your right side? Mm-hmm. Okay. Any kind of injections on the side of your body or anything that's been traumatic on your right side? Nothing you can think of. Okay. Alright, and this little tip right where your clavicle is, I'm going to press a little firmly. I just want to feel the nodes. And this might be a little bit, just a little bit more tender. Okay. Do the same on this side, even though we don't have the same swelling going on here. I just want to feel for symmetry. Okay. Do you mind lifting your arms up just a little bit here? And I'll use a little bit more pressure near your armpit region so that it doesn't cause you to be very ticklish, okay? Sometimes it's still ticklish. Mm. Okay. I'm just going to move down the sides. And go ahead and relax your arms. You're okay. Moving around back to your belly area, I'm going to go in a clockwise motion around. And what this does is it's actually in the same direction as your digestion of your large intestine. So if you're having any, gas buildup or anything like that, nothing to be embarrassed about. We're all just squishy little humans. So don't feel embarrassed if anything happens, okay? Okay, I'm just going to start on your bottom right here by your hip bone. And gently move up the side. Are you okay? That hurts? Alright, I'll be a little more gentle. Is that okay? Better. Just moving up just below your rib cage here. And then down your left side. Okay. Gonna press in the center towards your bladder here. Okay. Your tummy is very pliable, and in many cases that's a good thing. I'm going to tap on your belly. Okay, and on your left side. I'm going to reach around to the back area where your kidneys are. Is that okay? Alright. And again, let me know if anything feels uncomfortable, and we'll move forward, okay? Alright. I'll try not to tickle, I promise. Gonna reach around your right side here towards the back here. Just kind of feel that back area. Any pain? Okay. Okay. That's good. And then the other side. So no pain or tenderness in those areas. I'm just going to listen to your tummy sounds. So again, let me know if anything's uncomfortable. Okay. You can breathe normally. You don't have to hold your breath or anything like that. Okay. I'm just going to need you to try to sit still a little bit here. And I'm just going to listen. Okay. I'm going to continue to listen while I apply a little bit of pressure just under your rib cage there. Okay. Okay. Tell me if that's uncomfortable right there. Okay. How about right here? Okay. How about here? Okay. I'll have my stethoscope out. I'm going to listen to your heartbeat as well as your breathing, okay? So again, just breathe normally. I want to hear your normal rhythm. Try to relax if you can, okay? Okay, we're just listening to your upper right chamber. Okay. Go move down. Okay, and on this side. Okay. And lift up your left arm for me just a little bit there. I'm going to listen to the valves in your neck and your carotid arteries. Again, nothing special. You don't need to breathe in any particular way. Just try to relax. And go ahead and I can see you're clenching your teeth. Go ahead and try to relax your jaw. Okay, good job. Yeah, there's no reason to fret over this. This is just very basic stuff. Okay, now your other side. Try to relax this muscle right here. Okay, good job. Yeah, you're going to be okay. Just try to relax. I know sometimes it's easier said than done. You can move down a little bit here. Okay, very good. I'm going to move my stethoscope to the back. So I just want to listen to your lungs from the back a little bit here. Alright, and now I want you to take a deep breath in. I want you to hold it for a couple of seconds. So go ahead and inhale. Alright, and exhale. Very nice. Good. Move down a little bit lower. Inhale. And hold. And exhale. Okay. Do the same one more time. And hold. And exhale. Very nice. All right, just one more time on the back. Inhale. And exhale. All right, I just breathe normally. I'm going to listen to your normal respiration right here at the front here. Just breathe normally. Mm-hmm. Okay, move it down a little bit. Very nice. Okay, I want you to just do a slight little cough for me. Okay. And again. Well, some observations. You do have some gastro and intestinal audio that's being produced, probably just in relation to things that you're eating. I'd like to, in the future, schedule you for an allergy test, maybe take some blood, and that way we can see if you're sensitive to certain foods. I think that what you're experiencing might be more of an intestinal or a stomach-related issue, possibly ulcers, if you're experiencing heartburn, if you're experiencing this pain right in the center of your chest, especially after eating. I know that sometimes that can be more of a result from dietary consumption versus actual chest pain. That's just where you're feeling that occur. So if we can schedule you in for some blood testing, some allergy testing, that might give us a little bit more insight on that side of things. But also to be careful, I would like to schedule a CT scan, possibly an MRI, and in relation to the stomach suspicions, see whether or not an endoscopy exam might give us some more answers as well. Okay. We're not done with this exam, so let's rule out any other factors. I'm going to take your blood pressure, and now that we've been relaxed a little bit more in this environment, hopefully we won't be too stressed. So, do you have any side in particular that you prefer to have your blood pressure taken? Your left? Okay, sure. Just go ahead and lift up your arm. Okay. And now this will tighten up. You feel a little pinch. Just relax as much as you can. Just relax your arm. Very good. Okay. It's a little bit elevated, but given the discomfort, I'm not particularly surprised. Okay. How are you feeling right now? Feeling okay? That's good. Sometimes just a bit of relaxation can help. I'm going to use a fairly bright light. I want to take a look at your optical reflexes, your constriction and dilation. So just pick a brick on the wall behind me here, and I'm going to look very closely at your eyes, okay? Is it okay if I get a little bit close to you? Alright, thank you. And we're going to cover up one eye while I do this, okay? Restriction. Constriction. Okay, we'll do the same on the other side. Does it trigger any kind of pain or anything? Okay. Okay, very good. Real quick check inside your mouth. Open up your mouth and allow your tongue to be relaxed. I'm just going to use a tongue depressor. Just going to move your tongue to the side a little bit. Okay, now the other side. And look up for me. Say ah. Alright, you're good. Go ahead and relax. Alrighty. I think I'd like to schedule you for a couple of additional tests. I believe this might actually be originating from your stomach region. If you have ulcers and it's causing a acid reflux buildup, but also a pain, swelling related issue, that might include an endoscopy. And if we run you through those kind of tests, we'll put you under a general anesthesia. So it won't be a traumatic experience at all. You just go to sleep, we'll do the exam, you wake up, be nice and comfortable. And go through some of the dietary habits that you might have. Do some blood tests and see if there's any foods in particular that might be more agitating than others. Okay. No, they're separate exams, but they're going to be very easy. There's no pass or fail. These are just to get answers so that they might be able to help you function a little bit more comfortably. Okay. And if the chest pain continues after that, we'll give you a heart monitor, something that you can wear for a couple of days or a couple of weeks. And we can just see what your general cardiovascular activity is like, okay? All right. Well, thank you so much. It was so lovely being with you this afternoon. And I hope that you can get some rest and enjoy the remainder of your afternoon. Okay. I'll schedule those other appointments, and I'll see you in a day or two.